What's up, people, and welcome to another Medical Mazz episode of A Day in Life. Welcome to the channel. If this is your first time stopping by, welcome. If you're returning for the 5th, 600th time, you know the drill. Welcome back. And if you're here for the first time, we'll settle for a like. Anyways, I just walked into the ward thinking I'd get you guys started on the day. However, I walked into chaos. Like, what is ICU without any chaos? Nothing. So the chaos is coming from this patient that I received yesterday with breast CA with lung metastasis. So this is when breast cancer occurs when breast cells mutate and grow out of control. And of course, there are preceding factors to that. But if the breast cancer spreads, it typically goes to the nearby regions like your lymph nodes, under the arm, or the collarbone. If it spreads beyond the small glands to the other parts of the body, it is called metastatic breast CA. And for our patient, unfortunately, it spread to her lungs. Our patient presented with a cough, a persistent cough with shortness of breath, and was in severe pain. So the chaos really came from just miscommunication between the relatives themselves. There was one family member who was not there yesterday and had come in the morning questioning the nurses on why the patient was still in our facility, when in fact the other family members had told us to wait for that family member to come. With that being said, the patient is now being transferred to the other hospital. Today I've got 3 cases that I want to talk to you guys about. The first one is acute kidney injury on CKD, and the other one is atrial fibrillation with ischemic stroke. I think I talked about this patient yesterday. So we get into it. Let's get started with our beautiful day. All right, let's get started on the lab work. So right now I'm currently looking at the patient's lab results because this is still early in the morning. The attending hasn't come, so I just roughly go through the patient's lab results. If there are any missing lab results, I contact the lab, just call them, and then so that they can put them in the system. Yesterday we did a renal function test, which is basically checks on your blood urea and your creatinine levels, which we are looking at the kidneys, the kidneys. So in that we noticed that the patient's blood urea was elevated. It was 3 times normal, the normal parameter, and creatinine is also elevated. And so because he's also presenting with other uremic symptoms. Our patient was initially admitted due to hypoglycemia. He's a known type 2 diabetes patient with kidney disease. Children reported that he had presented with nausea, fatigue, muscle cramps, and decreased appetite for a really long time. Electrolytes, of course, that has to be something we look at in conjunction, and we found out that he has hyponatremia of 115, so low for him. So his chloride levels are really low as well. So here are some of the symptoms, the signs and symptoms you would see in a patient with hyponatremia, like we call it salt loss. Yeah, so it is crazy. It's the creatinine and the blood urea that is concerning, as well as the sodium and the chloride. The chloride actually seems to be going down than the last one on the 13th. So can't wait to get started on these cases. They seem very interesting. I love when there's like a good set of lab results. In the sense, it's not good for the patient right now, but at least it's a clear picture of what needs to be done and what we can do to help the patient. So let's get started with our day. I also have that patient with atrial fibrillation and stroke. We'll dive deep more into it when I explain about it, but for this time, let's go to the ward. As we walk into the ward, usually the ward round takes about 2 to 3 hours depending on the cases we have. Like today, the ward round took a little bit of my time. Today is not as crazy busy. Wait a minute. Now, why did I say those words? Trust me, I shouldn't have said that because I jinxed myself. Yep, so as I arrived to the ICU HDU department, the emergency department called me to let me know that they were letting in an 85-year-old woman with a diagnosis of acute ischemic stroke with atrial fibrillation and was already on maximum oxygen supply. So around 3 p.m., the nurses called me back to ICU HDU as I was in theater to let me know that the patient had gone into respiratory and cardiac arrest. Upon arrival, one nurse was already giving high quality CPR and it should be initiated within 1 minute of arrest. Compressions should not be halted for more than 10 seconds at any point during resuscitation. For successful ventilation, it should depend on 3 things: a patent airway, an adequate mask seal, and proper ventilation. The ventilatory rate should not exceed 10 to 12 breaths per minute and use the tidal volume enough to see the chest rise. Unfortunately, our patient ended up requiring intubation. Intubation was done and the patient was put on a ventilator. Using the advanced cardiac life support protocol or the algorithm, we regained the pulse. However, our patient still required to be on a ventilator. We are still monitoring the patient closely. What's up, beautiful people? I'm catching up with you guys. It's almost the end of the day. As you can see, it's 15:14. So I came to work thinking this was going to be a good day. We've discharged everybody. We've sent them to the general ward, but code blue. This is me leaving the hospital now and going home. So hello, good morning, people. Good people. Good morning. Yesterday I didn't close out the vlog. I was just depleted. As you can see, I'm still suffering from the tiredness of yesterday. But right now, the patient is currently on dopamine infusion because BPs have started going low. So yeah, I don't feel so great coming to work when it's like when you have patients like this, but you only hope for the best and pray for the best. But with that being said, let's get our day started. I just wanted to close out this vlog. I will be giving updates on this patient, and I think it's a really good case study. Yeah, pretty much. Yeah. But with that being said, I love that for me and I love that for you that you're here. This closing out is very, very out there.